Thank you very much. Dr. Sam Rizk is a board-certified facial plastic surgeon here in New York, and Janet Taylor is a psychiatrist in private practice. Good morning to both of you.
Good morning.
First of all, I want to say I like Aubrey's attitude. I like the fact that she seems to be saying, I'm going to take a wait-and-see approach to this. I'm not going to rush into it. Is that the way most teens deal with a situation like this, or do they tend to rush in more?
Go ahead.
Well, you know, here's the thing, Matt. I mean, yes, she has a choice, and she should make sure that she makes the right decision. But bullying is intentional, and bullying doesn't just stop because you've had a plastic surgery procedure. Self-acceptance is all about having the right perspective, and as parents, we play a critical role in helping our kids develop that.
As a doctor, Sam, when a teen comes to you and they talk about the fact I'm getting teased or I'm getting bullied, I mean, your job is to deal with the physical side, but how do you deal with that? What do you say to those teens about the emotional side of it?
That's actually a very important question, because the first thing I try to ascertain is whether they're being pushed to do it by somebody else, whether they're doing it for themselves, or is it a combination of external factors and internal factors. The most common is the rhinoplasty procedure for kids that I see in my practice. At age 14, they come in, they want to do a rhinoplasty. And I want to make sure that the parents are not pushing them to do it, that they want to do it, that it's going to improve their appearance. And also, it's not just a small little deformity. It has to be a major deformity that's really affected them.
He talks about parents pushing. I mean, oftentimes we look at our children and we see imperfections. But I love my children for their imperfections. But do you think the parent starts to kind of communicate their own fears, and that's what the child's reacting to?
Absolutely, that's one factor. And we need to love imperfections. No one is perfect.
That's right.
And so it really gets back to the parents are the key link. The parents are the key link for bullying, which is not, in my opinion, as related to plastic surgery procedures. But parental love, parental acceptance, and parental warmth can help prevent bullying, but also can help teach your kids how to accept themselves, which is a key factor of parenting.
Sam, these other common teenage procedures, you mentioned rhinoplasty, female breast augmentation, male breast reduction, female breast reduction, liposuction. Do you have a standard age in your office where you'll say, okay, no, you are too young for that procedure?
Yes, I think for breast work, that should be done much older. For me, if something is in the middle of your face and it's a big, large deformity, that can be addressed for girls at age 14, as early as 14, for boys at as early as 15, because they take a little longer to mature. Breast work and things that are less obvious, I think that should wait.
Does surgery being performed on a teenager make that teenager more likely to come in for more and more surgeries later on in their life?
Not necessarily. Not necessarily. I think they're in a vulnerable period in their life, and a lot of external factors are affecting them. So if you have a major deformity, it just adds more stress to the situation. They're less able to focus on school. And sometimes it's a combination of, trauma to the nose where they can't breathe.
Right.
And also the aesthetic component of it.
I think Sam draws the right line there. If this is a major deformity, one thing. If this is a minor imperfection and you're looking for perfection, that's a bad idea.
And the message is plastic surgery is not the be-all and end-all for a cure for self-esteem. It comes from the inside out.
That's a very good point, because the parents have to be involved with this. It's not just the surgery. It doesn't end with the surgery. Bullying will continue with other things if they don't address the factors involved in good self-esteem.
Sam Rizk and Janet Taylor, good information. Thanks to both of you. Appreciate it.